It's 1988 and Sir Rowland Henderson, a top civil servant, is briefing his staff. This is the plan for the NHS. Sir Rowland tells them about the 14 steps. Step 1. Healthcare is a service. We must transform it into a business. Like any business, therefore, we must separate it into provider and purchaser. Step 2. Starve the NHS of funds. Step 3. Cut training places and sell off land and accommodation. Step 4. Run a smear campaign against the NHS, its staff, its safety and even patients. Demoralise staff by hitting working conditions and pensions, forcing many to leave. Deprofessionalise the staff. Step 5. Facilitate a corporate takeover with private companies hiding under the NHS logo, so the public won't notice who is running the service. Step 6. Reduce beds, downgrade hospitals, close A&E departments, cut GP services, and as I mentioned, blame lack of staff, which puts patients at risk. Step 7. Pretend to separate the NHS from government and its obligation to care for the health of the nation, so that when things go wrong, the government can claim it's somebody else's fault. But of course, when things go right, we'll claim the credit. Step 8. Appoint a man with experience of the commercial healthcare sector to run the NHS, preferably with American experience. Tell him how much he should ask for to run the service, and when it proves to be inadequate, say, well, that's what the NHS asked for. In other words, continue to pass the buck and blame others. Step 9. Feed the media lines that are repeated parrot fashion to fool the public, like, reducing services leads to better patient care. The NHS needs to be more businesslike. We cannot afford a full health service. It's the fault of the obese, the immigrants and the elderly. And patients that abuse the service wouldn't do so if they had to pay for it. Step 10. Brew the perfect storm with a cocktail of underfunding, called overspending, lack of staff, services unable to cope, longer waiting lists and poor safety. Step 11. Get NHS providers, government appointed but pretending to be independent, to declare an NHS crisis, admitting it cannot provide services now with the funding it has, so something has to change. The government will repeat the lie. Well, we gave the NHS the money it asked for. As it still can't cope, soften up the public to accepting less care. We sell this with the usual trick of headlining something silly like banning dandruff treatment, but hiding the real meat like banning varicose vein operations, cataracts, hernias, knee and hip replacements. Step 12. So now tell the public we have no option but to introduce charges and to encourage trusts to ration care, but pretending ourselves not to support this as policy. Manipulate the BMA into asking for charges to be introduced so that they become the bad guys. Step 13. Introduce universal private health insurance, initially as a top-up for services now either rationed, not available or charged for. And finally, step 14. The final move is to a full US system with compulsory insurance, possibly through the employer. By this stage, we will have replaced the NHS with between 30 and 60 regions, much more manageable by the so-called care organisations. What is left is a very basic safety net emergency service. Fait accompli.